doctors in Florida now can do stem cell treatments. You know, I've had a friend that had to go to Canada to get a stem cell treatment for leukemia. What type of treatments can you do as a doctor in Florida with stem cell?
Very important point you bring up. As of July 1st of last year of 2025, the governor passed a law that allows physicians, both MDs and DO physicians, to offer stem cell treatments to their patients based on 3 qualifying conditions. The first being chronic pain, so patients that have been living with pain. The second being orthopedic conditions like osteoarthritis, bursitis, chondritis, things that are affecting your joints or bones or muscles. And the third condition is impaired wound healing. So when you have wounds that are just not healing in the traditional sense or with traditional approaches. So under those 3 conditions, doctors can offer patients stem cell treatments.
Okay.
And just like your friend, I've had medical conditions where I've had to fly overseas for stem cells. Specifically, I suffered from a very severe form of bronchitis after having had COVID. My asthma converted to bronchitis, and I was on 3 different medications, and I was not functioning well. I was not speaking well. I was not exercising well. I wasn't breathing well. And really, it was interfering with my life on a both professional and on a personal level. And a friend of mine, Dr. Shapiro from New York, invited me to go overseas to get stem cells with her. And I said, well, tell me more. You know, is it going to work? Is it going to help me? How much is it? You know, how do I get down there? She said, don't worry about it. I will get you in. You're going to come with me. And I said, okay, well, I'm willing to give it a shot. Why not? You know, I've read so much about stem cells. I've attended conferences that are all about stem cells. And I was really tired of taking medication and not feeling better. So I've had my own personal experience with stem cells. After 3 treatments, I'm happy to report that I'm no longer on medication.
Wow,
and you
great.
can hear me speak properly. I can exercise now, and the inflammation in my lungs is gone.
Wow.
So
wonderful.
It is miraculous, and it's the frontier of medicine.
And do you think that will expand here in the States, or are we just too conservative?
Expand in other states of the country?
No, as far as expanding the use of stem cell treatment to other issues.
I hope it does, because there are several studies that have shown the use of umbilical cord stem cells, so stem cells from donated placenta and umbilical cord tissue, that have shown improvements and better outcomes in cases where patients have frailty, so older individuals that are fallen, that are weak, heart failure, rheumatoid arthritis, and osteoarthritis. So very, very common conditions that people struggle with as they get older. And these are publications that are available for everyone to look at.
Sure.
So I do hope, and I do believe that in the future we'll have more indications for stem cells. And there are several clinical trials currently undergoing in the U.S. That are ongoing, I should say. And I think in the very near future, patients will be able to experience the benefits of stem cells here in this country.
Well, that would be great. So, well, we'll keep our fingers crossed.